So small business, just real quickly, because I know there's some confusion about small business owners. So the one thing I want you to know about, obviously the Affordable Care Act from January 2014, it is now law that everybody must have purchase health insurance. By the way, there's 9 exemptions to that, which, if somebody wants to know, I can tell you about some of them. But one of the other mandates is that if you are a small business owner, and this is the part that's important, if you're a small business owner with more than 50 full-time equivalent employees, you are going to be mandated to provide health insurance to employees. If you have fewer than 50, you are not required. So that's very important to remember. I know a lot of small business owners get nervous about that. If you have less than 50 full-time equivalent employees, you are not required to provide health insurance to your employees. Now, if you are a small business and you have less than 50 and you decide you don't want to offer them health insurance, those individuals now will purchase their insurance through the marketplace. That would be one of the examples of people who would buy their insurance through the marketplace now. Now, we want to incentivize small business owners to do that, but again, they're not required to. And so how are we going to incentivize small business owners? We've actually created a separate marketplace just for small business owners called SHOP. So again, while small business owners are not going to be required to buy health insurance for their employees, we're certainly hoping that they will. We think there's 2 ways they benefit from this. One, we think this competition actually brings down premiums for them. Large companies get to negotiate with health insurance plans for rates. Small businesses don't, but we think this gives them, they're going to have leverage and power because they're all going to be in a collective pool together. And so we think it brings premium rates down. But the second way is we started offering tax credits to small businesses in 2010. What becomes true in January 2014, any small business with up to 25 full-time equivalent employees can get up to 50% tax credit to help them purchase health insurance for their employees. And just so you know, I keep saying full-time equivalent because by the way, all this is IRS stuff, so I had to start becoming an IRS expert. So all of this is IRS regulations, that's why I put up there, this is actually the purview of IRS and labor. So, don't hold me to some of this from HHS, it's not our area. But I keep mentioning full-time equivalent because IRS actually considers full-time as 30 hours a week. So that does become important for small business owners to know that it's the calculations is anybody who works 30 hours a week is actually considered a full-time employee for IRS purposes. Oh, and in case you want to know, if anybody's a small business owner, how you start getting penalized if you're a small business owner if you have over 50 employees and you decide I'm not going to offer the health insurance anyway, you get penalized if you don't provide coverage to 95% of your employees, or if even one of your employees buys their health insurance through the health insurance marketplace. Now, if you're offering them credible insurance, and only if they're buying it through the health insurance marketplace, and this is a very important caveat, and they get the financial assistance. Now, if you're actually giving them affordable, comprehensive coverage, they're not going to qualify for the financial assistance. So they could still buy their health insurance in the marketplace if they wanted to, but they wouldn't get any financial assistance from us because an employer offered it to them. So the penalty doesn't kick in. And I know this is really complicated, so it's a whole other small business session if anybody wanted to know about it. But basically, if you don't offer to 95% of your employees, the penalty kicks in.